When you hear the word inflammation, what comes to mind? Things like pain, swelling, something to be worried about, something to fear. What if I told you that inflammation is actually your body's way of saying, I got this? This is what many people don't get about inflammation. My name is Dr. Terranella, and this channel is dedicated to helping you improve and optimize your health. Today, we're going to look at what many people don't get about inflammation and explore the clues that your immune system is giving to you about what's going on in your body. If you're liking this kind of information and want to continue getting informed and helpful information about your body and health, click on that like and subscribe button to continue getting videos like this. All right, let's jump into the video. So today we're going to look at what many people don't get about inflammation. And inflammation is often a term that's thrown around in negative context. But did you know that inflammation actually means your immune system is hard at work? Let's take an example of when you get a cut on your skin, for instance. The area around the skin where your body's been cut and exposed gets red, swollen, and sometimes irritated, right? That's actually inflammation at work. It's your body's way of protecting the cut from being infected and starting to heal, remove the dead debris, and lay down new skin, new tissue. So when you say you're inflamed, essentially what you're saying is you have increased immune activity going on there. And so not all inflammation is bad. In fact, it's crucial for our survival, and oftentimes the inflammation can be collateral damage that's occurring, but it's needed to protect our tissues and our bodies. And still, sometimes this good inflammation, this process that's needed, can also lead to problems too. So that's what we're going to explore, is both the good and bad side of inflammation. And when it comes to your immune system, of course, balance is key. This is probably one of the most delicate systems in our body with regard to balance. So we're going to look at how the immune system has positive aspects and how sometimes that balance can get thrown off and lead to some negative consequences, how things can go wrong as well. And so the positive aspects of our immune system when things are going well, it's like a multi-talented team of cells providing just enough of the right response on each occasion. And so let's look at 4 common aspects of inflammation in the immune system that you're likely to encounter on a somewhat regular basis. So there is, of course, protection from invaders. And when we get sick with a cold or flu or a digestive bug, your immune system is definitely going to be hard at work there. And it's battling the pathogens to protect and prevent those bugs from getting deeper, getting further into your body and into your tissues. And that battle causes what we know and call inflammation and damage initially. And that's why there's often pain and sensitivity when that inflammation is going on. And this is actually a good thing. If you didn't have that, those microbes would be free to just go wherever they wanted to. And it's good as long as the microbe or pathogen is actually cleared in a timely manner. And as long as your body has the ability then to turn off or downregulate that battle or inflammation after the microbe is gone or gotten rid of. Sometimes, and in some occasions, the immune system keeps going long after the microbe is gone. And this can happen if the signal to stop the attack is not strong enough from the immune system and from other circulating messages from the body. And that's how we can end up with lingering colds and flus and all types of problems in our lungs and sinuses, because that immune fight signal is not turned off and the inflammation is not kept in check. It just keeps going on and on long after the bug has been cleared. Still, in these situations too, when you have a cold or flu or upper respiratory tract infection that's lingering for weeks and months, it can be hard to know if the infection is gone or if there's lingering inflammation. And so if you have this lingering type of infection going on, this is the type of question you want to be asking yourself. Is the inflammatory signal still going, or do I still have an infection? And especially if this is a reoccurring thing, it's going to allow you to look at where the deficits are in your immune system so you can resolve this type of thing much quicker next time around. So the next example we want to look at is an example with tissue repair. The normal and good response is when we injure a tendon, ligament, or some other body part with exercise or something like that, and that injured tissue is recognized by specific cells in the immune system, and it triggers a cascade of events where your body's going to remove and repair those injured tissue and debris. And what we're going to feel when that process is going on is a lot of pain, swelling, heat, and inflammation. And we want this to happen because without this, the tissue will just stay damaged and will be weaker than it was before. With the inflammation, we're able to lay down new tissue that's fresh, and that new ligament or tendon is going to be stronger in the process. Yet too much of this inflammation, this repair process, can also lead to problems. During the repair process, there's actually a separate but distinct mechanism that also gets triggered at the end of the process, and that's called the resolution phase or mechanism. And chemical messengers that are referred to as resolvins cause the immune cells that are clearing the debris to be downregulated and stop their activity or reduce their activity. And with less of these types of immune signals and immune cells around, the body can more effectively lay down new healthy tissue. Without this, those immune cells are continuing to try to remove even the new tissue, and the new tissue gets damaged as well. And this is kind of similar to the previous example with the infection in the lungs. When there's too much immune activity, too much immune signal to remove the debris, to get rid of the microbes and other problems there, it can end up damaging the new tissue and the healthy tissue. And that's because there's not enough of the resolve or down-regulate the inflammatory process. And you end up with chronic inflammation in that joint or ligament or tendon. And with that, you're going to feel chronic inflammation, chronic damage going on in that injured tissue. And this is a difference between what we refer to as tendinitis versus tendinosis. With tendinitis, it's going to last a few weeks, maybe a month. And with tendinosis, it's going to last several months or even longer. And if you have a lingering injury going on in your shoulder or elbow or knees or something like that, chances are you're overworking that injured tissue so it can't properly complete the repair process. Or it may need a little bit more support to complete that healing process. This is where things like acupuncture and physical therapy, and even things like taking oral resolvins can help. And I'll put a link to the description in one that you might find useful. All right, let's look at another example of common immune responses that you may encounter, such as allergies. So different immune cells handle different tasks. And in the case of allergies, there are certain types of cells that are going to produce your histamine. And with that histamine, it's going to prevent those allergens from entering in the body, from getting deeper into the tissues. Histamine is one of the primary things that is going to cause the classic allergy symptoms. And these symptoms are a result of your immune system over-responding or overreacting to harmless substances like pollen and cat dander, things like that. And it's a histamine that's classically thought to cause some of this, like sneezing, itching, watery eyes, etc. And we can think of this immune response as a good thing because it's aimed at preventing that allergen from getting deeper into the body. For instance, the more vigorous the allergic response, the more potential there is for harm. And the deeper that allergen gets, the more vigorous the response is going to be. And we see this in cases like anaphylaxis, when the response is so rapid, so vigorous and strong that you can have your airway actually close down, and that can lead to very bad problems, including death. In moderate allergic response or even mild allergic response, it can lead people to be susceptible to infections because those allergens are creating more mucus, and that just creates a nice environment for those microbes. It's also the case that some of the immune cells are going to be shifted towards fighting off the allergies and leaving holes open for infectious things to come in, meaning less of the immune cells are going to be available for fighting off some of the bugs that are naturally around us on a daily basis. So the last thing we want to look at is a global phenomenon of chronic ongoing immune response and inflammation. And we can see this with things like infections, injuries, allergies, and in these situations, it's like there's a smoldering fire that's going on, but it never completely goes out. And in these cases, it's really never really good that this is occurring and can be problematic for several reasons. For example, with this ongoing smoldering inflammation, there's ongoing tissue damage. And each time the tissue is damaged, the immune cells are going to take pieces of that tissue and present that tissue to other immune cells to determine if that tissue is self or other, meaning is it part of the body or a foreign invader. And once in a while during this process, the immune cells actually make a mistake and see the tissues of the self as a foreign invader. And this is one way that the autoimmune process gets started. And these are going to be conditions like rheumatoid arthritis, lupus, scleroderma, and even multiple sclerosis. And these are all examples where the immune system's response becomes problematic or more of a burden or problem to the body. And so in this way, the more ongoing inflammation in the tissues, the more potential you have for autoimmune problems to occur down the road. And that's why chronic infections and chronic inflammation in general is so bad. So if you have this kind of problem going on, it's important to find the source and try to get that problem resolved, whether it's ongoing allergies or infections and the like. But keep in mind too that some inflammation and immune response are needed to protect our bodies, and it's helpful for that inflammation to go up and then come down. As long as it's coming down, there's no problem, nothing really to worry about. And so that's where balance is key. And so next time you hear the word inflammation, remember it's more than just a problem. It's a sign that your body's incredible immune system is at work. But as incredible as this immune system and this process is, it's important to note that too much inflammation in your immune response can lead to problems too, like we discussed, autoimmune and chronic tissue damage. Hopefully this video helps you better understand inflammation and what it is. If you do have questions about anything in this video, drop it in the comment section. I'm happy to answer your question. If you want a more customized, nuanced answer, consider joining the membership program. We'll have more time and attention to dedicate to your questions. Now, one question you might have after listening to this video or watching this video is, how do I measure, how do I detect inflammation in my own body effectively? And you can find more information on that topic in this video right here.